since the doctors aren't acknowledging, like, scar tissue is a big deal and this could affect a lot of different things. It could be a rectal sphincter repair that somehow ends up as vaginal discomfort or lower back problems or SI problems or mid-back problems, and presents itself as another kind of pain when we know that the scar tissue is the source of the problem. So the doctors don't know that scars can be active scars. The doctors don't know that it's not as simple as just stitching it up and then you'll never have a problem again with it. And then the women don't know to even ask about it because it's not out in the open that this is a potential contributor to sexual function, to an ability to even contact that musculature, to contact pleasure.
Yes, I was just writing today. I'm working on my dissertation, madly drawing the connections between sexual function and scar tissue. And the neurological substrate is sort of a scientific term, but it describes really well that there are nerve plexuses and nerve interchanges, like a superhighway of neural information that comes into the pelvic floor, to the anal sphincter, to the vagina, to the clitoris, to the G-spot. Some of these are pleasure centers in the body. Some of them are elimination centers in the body, but the nerves themselves can be damaged. So it's difficult to propagate a pleasure response that can then feed into desire and arousal, just like it can be difficult to propagate sphincter function. So the urinary sphincters can open and close, the anal sphincters can open and close and be closed at the right time and open at the right time. So people end up with urinary incontinence, fecal incontinence, or an inability to control the muscles of their pelvic floor, or their
inability to lubricate because the scar tissue is penetrating the lubricating tissue.
Yes, the lubricating, there's a template of dense connective tissue that prevents the lubrication. Lubrication is pushed out of the capillary beds up into the tissues of the vulvar skin. And if there's a layer of dense connective tissue, it can prevent the pushing of that lubricating tissue, or it could even prevent the engorgement of the capillaries, which drives lubrication, because the capillaries themselves can't fill with blood and then propagate lubrication. And so it can really affect sexual function at so many levels.